Cleft lip and cleft palate are birth defects that affect the upper lip and roof of the mouth. They happen when the tissue that forms the roof of the mouth and upper lip don't join before birth. The problem can range from a small notch in the lip to a groove that runs into the roof of the mouth and nose. This can affect the way the child's face looks. It can also lead to problems with eating, talking, and ear infections. The exact cause of cleft lip and cleft palate is not completely understood. Cleft lip and cleft palate are caused by multiple genes inherited from both parents, as well as environmental factors that scientists do not yet fully understand. When a combination of genes and environmental factors cause a condition, the inheritance is called multifactorial, where many factors contribute to the cause. Some forms of cleft palate are easy to see when the child is born. But even if the cleft palate doesn't affect how the baby's face looks, it can usually be seen inside the mouth. The location of the cleft matters more than how it looks. A small cleft in the soft palate may cause more problems because of its effect on speech than a large cleft that is easy to see. Babies with cleft palate often have feeding problems because they aren't able to suck and swallow normally. But this doesn't always last, especially with treatment. A doctor can diagnose cleft palate by doing a physical exam of the baby's mouth shortly after birth. Fetal ultrasound can sometimes find cleft palate as early as 14 to 16 weeks into pregnancy, especially if the cleft palate is severe and occurs along with a cleft lip. But ultrasounds do not always find the problem, so doctors do not rely on it to diagnose cleft palate. Beyond the cosmetic abnormality, there are other possible complications that may be associated with cleft lip and cleft palate, including the following. Feeding difficulties occur more with cleft palate abnormalities. The infant may be unable to suck properly because the roof of the mouth is not formed completely. Ear infections occur frequently and are often due to a dysfunction of the tube that connects the middle ear and the throat. Recurrent infections can lead to hearing loss. Speech and language delay is common due to the opening of the roof of the mouth and the lip. Muscle function may be decreased, which can lead to a delay in speech or abnormal speech. Referral to a speech therapist should be discussed with your child's physician. Dental issues can occur as a result of the abnormalities. Teeth may not erupt normally, and orthodontic treatment is usually required. Treatment involves a team of healthcare providers. The type of treatment depends on how severe the problem is. Surgery is the most common treatment for cleft palate. In most cases, it is done when the child is between 9 months and 12 months old. Reparative surgery generally lasts between 2 and 6 hours and is done under general anesthesia. Children spend at least 1 night in the hospital following the procedure. Surgical costs will depend on the hospital, surgeon, and individual case. However, surgeries generally range in price from $5,000 to more than $6,000. You will need to talk with your insurance company for details about coverage for surgeries and specialty care. If such treatments are considered to be reparative procedures, the majority of costs of surgery and specialists may be covered by your insurance company. Before surgery occurs, your baby may need treatment for breathing or feeding problems. He or she may also wear a mouth support, such as a dental splint, a soft dental molding insert, or medical adhesive tape. Surgery to repair the palate may help alleviate speech problems and ear infections by allowing for middle ear drainage. Ongoing speech therapy and ear tubes may also be used. Dissolvable stitches that disintegrate on their own are often used. After surgery, children may not be able to use utensils or straws or eat solid foods for the first few days. They will need to eat only soft foods for the first week to week and a half after surgery and refrain from rough play that may disturb the sutures. Healing time may vary for each child. However, children are usually back to normal eating and playing habits within 2 to 4 weeks of the surgery. Children with an unrepaired cleft lip and/or palate may face some or all of the following challenges: looking different, speech difficulties, hearing impairments, having to deal with staring, comments or questions, having to cope with regular hospital appointments and worries about operations, bullying, or teasing. Children who have undergone reparative therapy may still have speech difficulties, hearing impairment, and feelings of self-consciousness about scars and appearances. Support from various members of the care team can be used to address these challenges. Social workers may be used to provide psychosocial support. Audiologists can be used to adapt to hearing limitations, and speech therapists help children overcome speech difficulties. These challenges can make a child feel different from their peers, and in turn may result in poor self-confidence and low self-esteem, difficulty making friends, and behavior problems. There are times when a child with a cleft lip and/or palate may be more vulnerable than others. These include times of change, such as moving up an academic year or changing schools, and before operations. However, it is important to remember that many children with a cleft lip and/or palate do well at school and do not need to see a psychologist. Scars from cleft palate reparation will be present throughout the lifetime and may be a challenge for individuals into adulthood. However, in some cases, cosmetic surgery can be used to reduce the appearance of scars or change the shape of the lip or nose. Such surgeries are not covered by many insurance plans if they are considered to be elective procedures. Other complications such as speech abnormalities and hearing impairment may persist into adulthood. With surgery and support from members of the care team throughout their growth in childhood, many adults can minimize the effects of a cleft palate on their everyday lives. The Craniofacial Anomalies Multidisciplinary Program, or CAMP, at the University of Chicago provides a thorough, team approach for the evaluation, diagnosis, and treatment of children with craniosynostosis and other craniofacial disorders, such as frontonasal dysplasia, cleidocranial dysplasia, encephalocele, and rare craniofacial clefts. Craniosynostosis is a rare birth defect that causes one or more sutures or the connections that separate individual skull bones in a baby's face or head to close prematurely, affecting normal brain and skull growth. CAMP is one of the largest craniofacial programs in the region and is staffed by the largest pediatric neurosurgery group in Chicago, as well as premier pediatric plastic and reconstructive surgeons and renowned experts in genetics and neuroradiology. The Craniofacial Anomaly Treatment Team at the University of Chicago includes a multidisciplinary approach. There may be many people involved in the management of craniofacial anomalies for your child, because the skills of many different areas are needed to help with the problems that can occur. The following are some of the members of the craniofacial team. Plastic or craniofacial surgeon, a surgeon with specialized training in the diagnosis and treatment of skeletal abnormalities of the skull, facial bones, and soft tissue, will work closely with the orthodontists and other specialists to coordinate a surgical plan. If you receive insurance through a managed care organization, you may need to have a referral from your primary care physician and pre-approval for such specialty services to be covered. Neurosurgeon, a surgeon who specializes in the brain, spinal cord, and nerves. Also coordinates all surgical interventions of head abnormalities with the craniofacial surgeons, such as craniosynostosis. Pediatrician, a physician who will follow your child as he or she grows and help coordinate the multiple specialists involved. Orthodontist, a dentist who evaluates the position and alignment of your child's teeth and coordinates a treatment plan with the surgeon and other specialists. Pediatric dentist, a dentist who evaluates and cares for your child's teeth. Speech and language specialist, a professional who will perform a comprehensive speech evaluation to assess your child's communicative abilities and who will closely monitor your child throughout all developmental stages. Otolaryngologist, or ear, nose, and throat specialist, a physician who will assist in the evaluation and management of ear infections and hearing loss that may be side effects of your child's cleft abnormality. Audiologist, or hearing specialist, a professional who will assist in the evaluation and management of any hearing difficulties your child may have. Ophthalmologist, a physician who specializes in the structures, functionality, and diseases of the eye. An ophthalmologist evaluates and plans treatment of associated eye problems in coordination with other surgical interventions. Genetic counselor, a professional who reviews the medical and family history, as well as examines your child to help in diagnosis. Nurse team coordinator, a registered nurse who combines experience in pediatric nursing with specialization in the care of your child and acts as liaison between your family and the craniofacial team. Social worker, a professional who provides guidance and counseling for your child and your family in dealing with the social and emotional aspects of a craniofacial abnormality and assists your family with community resources and referrals, such as support groups. Psychiatrist, a physician who assesses the psychosocial function and behavioral development of your child. The psychiatrist will assist the family in identifying therapy resources and will coordinate referrals with the social services department. Our team can assist with both pre-adoption and post-adoption evaluations and assessment, and even provide in-country consultation with craniofacial specialists when necessary. The Adoption Center partners with families to provide compassionate, state-of-the-art care to children with cleft lip or cleft palate. The 5-visit structure helps families welcome a new child into their home while synthesizing disease-specific information and integrating the care of this child into normal family life. The Adoption Center is part of Comer Children's Hospital and allows families access to the most current national guidelines and research involving the care of the child or adolescent with cleft lip or cleft palate. After the Adoption Center's 5 adoption visits, your family may choose to continue on with us or transition to a local community provider. Families who choose to move on to a local community provider will receive a transitioning packet for the pediatrician, giving a background to your family's story. If needed, our team is able to provide longer care relationships, especially for children with cleft lip and/or palate or other significant special needs for chronic health concerns. In addition to serving as liaison to referring specialists at Comer, our team also provides checkups to monitor your child's progress if needed. Whichever path your family takes, know that you can always come home to Comer.